No more wrist pain. Injury to any part of the wrist can cause pain and affect your ability to use your wrist and hand. Injuries can be caused by 1. Sudden impact. Wrist injuries often occur when you fall forward and use your hands to support yourself. It can cause hand sprains, strains, or even fractures. Scaphoid fractures often involve the bone on the thumb side of the wrist. X-rays may not show this type of fracture immediately after the injury. 2. Repetitive stress. Any repetitive movement of the wrist can cause inflammation of the tissue surrounding the joint or lead to a stress fracture. Such sports include hitting tennis balls, playing the cello, or driving an off-road vehicle. The risk of injury is higher when you perform a movement for hours on end without a break. Radial styloid stenosing tenosynovitis is a repetitive stress injury that causes pain at the base of the thumb. Arthritis. 1. Osteoarthritis. This type of arthritis occurs over time when the cartilage that cushions the ends of bones wears away. Osteoarthritis of the wrist is uncommon and usually only occurs in people who have had a previous injury to the wrist joint. 2. Rheumatoid arthritis. Rheumatoid arthritis is a disease in which the body's immune system attacks its own tissues, often affecting the wrists. If one wrist is affected, the other is usually affected as well. Other diseases and conditions. 1. Carpal tunnel syndrome. Carpal tunnel syndrome results from increased pressure on the median nerve as it passes through the carpal tunnel, the passage on the palm side of the wrist. 2. Ganglion cyst. This soft tissue cyst most commonly occurs on the wrist opposite the palm of the hand. Ganglion cysts may be painful, and the pain may worsen or improve with activity. Avascular necrosis of bone in 3 months. The condition, which usually affects younger people, causes a small bone in the patient's wrist to gradually collapse. Avascular necrosis of the lunate occurs when the blood supply to this bone is insufficient.